Today I am going to talk about stroke on the occasion of World Stroke Day, which happens to be on 29th October of every year. Every year we commemorate Stroke Day to learn about stroke because the concept is time is brain. Whenever an individual develops stroke, it has to be identified very fast, that is by using this mnemonic called FAST, F-A-S-T. If any individual suddenly develops weakness on one side of the face and his speech becomes garbled, and if you notice that his arm is weak, and immediately he has to be shifted to a nearby hospital because minutes save millions of neurons. If 1 minute delay is there, 9 million neurons will die. That will affect the individual's memory, the speech, the swallowing, the motility, the independence, so many of the behaviors, and he will become disabled. So you should know what is stroke. Stroke happens because of lack of blood supply to the brain because of a blood clot, or it can be because of rupture of the blood vessel, or it can be blood clot in the veins. All these things can cause, but most important cause is the blood clot that happens in the circulation, which prevents the brain from getting enough oxygen and enough glucose, because all the neurons are dependent on oxygen and glucose. So if a stroke comes nowadays, there are treatments which are to be given within a stipulated time. Most important thing is give treatment as soon as possible. If by vein or intravenous route, what we say can be given up to 4.5 hours, a drug called recombinant tissue plasminogen activator, which will completely lyse the clot and restore the blood supply, and brain survives. If you are not able to reach within 4.5 hours, also there are treatments that are called thrombectomy, endovascular treatments. A blood clot can be removed through catheter means in the facilities are available in the nearby hospital. So that also will again help recovery in a lot of individuals. That can be given up to 24 hours. So just imagine how it is important to reach a hospital which is capable of providing both intravenous thrombolytic therapy and intra-arterial endovascular therapy. And also, if it is beyond 24 hours, there is an exceptional care that can be given in neurocritical care by looking after the complications that can come with stroke, like fever, the difficulty in swallowing, blood pressure, glucose monitoring. All these are very important to monitor first 72 to or beyond 72 hours also, because there may be complications which may jeopardize the survival of the patient. So in essence, we have to prevent stroke because prevention is better than cure. So there are 10 risk factors which you have to look into to prevent happening a stroke, because stroke is the second commonest cause of death and disability in our country. 1 in 3 individuals are suffering from stroke. Earlier it used to be 1 in 6. Now it's growing at a very rapid, fast score because of the risk factors of hypertension, diabetes, smoking, hypercholesterolemia, lack of physical activity, obesity, etc., etc. So World Stroke Organization has now given a slogan this year: be active to prevent the stroke by adopting sports culture. You'll have to make physically active yourself by adopting to any type of sports activity so that you remain active. That means physical activity will prevent stroke. So with this and few words, I will wish you all the best. So save lives, save time, save minutes, because time is brain, and improve your physical activity is 2024's World Stroke Organization slogan. Thank you very much.